Hello, humans! Welcome to another interview series. It is part of the Total Worker Health Symposium that is going down later this month in Bethesda. And we also have virtual options. And we find out this evening if we are doing it in real life or if it's all going to be virtual. And you can still get your ticket. It's available on the website. And today we have Sarah Rauzin. She just told me how to pronounce her last name, and I hope I got it right. Okay, and I'm very, very excited to talk to her today because we're going to get into it. But she is talking about menopause at work, which, if you follow me outside of LinkedIn, this is something that a lot of my humans are going through, especially with ADHD. So a lot of us don't realize we don't have the coping skills to deal with ADHD until menopause and perimenopause hits, and then everything starts to transition and change because of the dopamine and the estrogen levels, but we'll talk about that in a sec. Okay, Sarah, thank you so much for being here.
Okay, I'm so glad to be here. Thank you for having me in the conversation.
Yeah, this is going to be fun. Okay, Sarah Rauzin is a public health strategist and cross-sector collaborator, advancing workplace-driven solutions in today's most urgent health challenges. As director and lead of research and advisory at Meteorite, the organization behind the Health Action Alliance, she helps employers translate complex public health issues into clear, actionable strategies that support employee well-being and strengthen business resilience. Her work spans a wide range of issues, including mental health, women's health, chronic conditions, respiratory health, and MSD prevention. With a background in prevention science and crisis response, Sarah has authored programs that bring public health theory into practical application in college, military, and workplace settings, including SHIELD, an award-winning leadership and sexual assault prevention program with Jacksonville Naval Air Station. Through every initiative, Sarah leads with deep listening, drawing on diverse perspectives and data-driven insights to align shared values into win-win strategies that drive real-world impact. That's very impressive, Sarah. Nice job. Okay, so question number one. Menopause is generating quite the buzz lately. What's behind this trend, and why does conversations matter for employers?
So this is, I think, a wonderful start because we are seeing this cultural zeitgeist right now around menopause. And there's a few factors coming into play here. But primarily, I want to level set that when we're talking about menopause symptoms, brain fog, hot flashes, fatigue, what we're referring to is actually this period of transition called perimenopause, which can last for up to a decade before a formal menopause diagnosis and can start as early as age 35. So a lot of the women who are now entering this period of perimenopause are actually part of the same workforce generation that champion for better mental health support. And they're social media natives. These are people who are not shy about bringing up their challenges and needs in social conversation. And now, as many of these same women who are part of this generation are entering this phase of perimenopause, they're stunned at how wholly unprepared they are and wondering why no one's been talking about it before. We're now also seeing politicians, celebrities, influencers taking up the mantle. And this has its pros and cons. We are seeing a lot more of these conversations happening. We're normalizing symptoms. Women are no longer feeling like they're alone or being gaslit in what they're experiencing. And we're getting that word out. But we're still facing these gaps in solutions in our healthcare system. And so more and more women are turning to social media to learn about what it is that they're going through. And this means that they're also being subject to these floodgates on misinformation and conflicting messages about evidence-based care. So all of this confusion and misdirection and these gaps that are still remaining in solutions are still ultimately leaving women without critical care that they need. The Mayo Clinic Proceedings has estimated that the excess costs of navigating broken systems of ineffective care totals $26.6 billion annually, both in direct medical expenses and increased absenteeism. And with a lot of women still left grappling with untreated symptoms, many are considering leaving the workforce entirely, often at the peak of their careers when they've acquired decades of institutional and industry knowledge and are entering or holding positions of leadership at their organization. So this is very much a business conversation and a business priority.
Yeah, I agree. It is also so frustrating because for so many decades, because of the way that women work, they weren't studied because it was so challenging because of our fluctuations of our hormones and different things. Every single day, we're a different human, right? So for so many years, and then that research study that came out, I think in the 90s or 2000s, that was like the one bad research study that really said that HRT, hormone replacement therapy, was not safe. And that study has been debunked. And now I love, what's her name? Dr. Mary Haver Claire, Dr.
Mm-hmm.
Mary Claire Haver, who's now educating based on science of like, this is what happens. And I love how she always says, and you mentioned it too, it's 10 years. So we always think like menopause happens around 50-ish, but 10 years, 10 to 15 years before and after, it depends on the human. It depends on so many things. Like for me, I've had 3 abdominal surgery and no kids. So I am experiencing perimenopause symptoms right now. And it's just really interesting because one of the things I'm really passionate about too with neurodiversity and menopause and all these things is to reduce the stigma, because we are human beings. And as much as we know every individual is different and their support systems they need are different, but to talk about this stuff, because as human beings, we experience things, not just in a bubble at work or in life. Our health and our mindset and all that stuff affects us in the workplace. So I love that you're speaking about this and getting out there and bringing this from the science perspective and being able to talk about this to reduce the stigma. How have you, on this journey so far, how have you been met with when you're talking about menopause in the workplace, when you're talking about this is an important thing and it's so much of our workforce and it's not really like, it's just starting to become trendy now? I find it's very similar as like ADHD is super trendy on the Instagram social media side for the individual, but trying to get into corporations and companies, we receive, at least I receive a little bit of like, this is a nice to have, but we don't need it yet. What's your opinion on that?
So there's a lot to unpack, and I think that's a really great question. I want to start with how is this being received? And there's still a lot of disconnect between the conversation and what's actually happening in practice. But we are starting this conversation at this really interesting, important time when employers are hearing about this as a trending conversation, and they're asking for this information because they want to know what to do and they're excited about it. And a lot of employers, particularly people who are in charge of roles where they're making decisions about benefits and workplace policies, HR leaders, public health leaders, health and safety leaders, a lot of them are women entering this life stage themselves. So it's not just about business and the workforce, it's also very personal, and they're looking for the tools to be able to make the business case and apply this work in their own organizations. So I think we're doing this work at exactly the right moment in time where the reception is there, the interest is there, and we have a lot of an opportunity to inspire change right now. You also mentioned, what's with the disconnect and why is this being seen as maybe a nice to have, particularly as a lot of employers, even if they care and they're hearing this increased demand, they're not necessarily seeing this as a worthwhile line item as they're facing grappling costs. So as we really break down the business case, I just cited that $26.6 billion drain. This is actually broken down in a couple of different ways with Mayo Clinic proceedings. Over 90% of those costs are actually from untreated symptoms, those hot flashes and night sweats. That's costing $24.8 billion annually, as women are going completely without a diagnosis because we have a number of physicians who don't receive any training on menopause. I think only a third of OBGYNs even receive formal training on menopause, and that's OBGYNs where you would expect them to have a level of specialty. Most healthcare providers say they're lucky if they even got a seminar in medical school about menopause, despite the fact that this is a period that lasts over a decade, impacts women's entire bodies. It's not just a hormonal issue, it's a brain issue, it's a musculoskeletal issue. It's a whole person, whole body, whole relationship, whole system issue that people are completely missing when women are coming in and describing their symptoms, and they're getting misdiagnosed. They're cycling through provider to provider to get the right care, and they're trying treatments that ultimately don't work for them. And this is generating that excess expense. And on top of that, there's an additional $1.8 billion in absenteeism, as women are going to all of these different providers and still at the end of the day left without the right right treatment to manage their symptoms. But even aside from healthcare costs and absenteeism, 2 in 5 women have either already left or are considering leaving the workplace because they just don't have the right care that they need. And they're leaving at the very peak of their earning and leadership years. And these are people that organizations have been investing in for decades. And when they leave, you're not just leaving that one employee, you're losing institutional knowledge, client relationships, mentorship capacity, and an entire pipeline for leadership. So what we're trying to say to employers is, as you're looking at your cost mitigation strategy, one, you cannot afford to ignore this, because this inefficiency spend is really pulling out from your line items for your business profitability, and you need to be taking an active role in reducing this inefficiency in care. But also, a lot of the things that are actually needed for menopause support in the workplace don't require a massive overhaul in benefits. What we've been really trying to promote in our message through our initiative is that most organizations actually already have a lot of support in place. And getting started with better menopause support is often just a matter of simply reframing and reconnecting and better promoting the benefits that you already have to explicitly name menopause and make those connections for employees. These are things like paid leave, flexible schedules, moisture wicking uniforms, breaks, and if possible, remote and hybrid work options. And the other great thing is, these aren't just policies that are good for employees navigating menopause. They're actually good for all employees through every stage of life. So this is a real opportunity, not just to address menopause, but to actually improve well-being across your workforce, all while helping reduce inefficiencies in care that can save your business money.
I love that. And Sarah has shared some resources. So as soon as the live stream is over, I'm going to add that in the comments on all the platforms that we are doing, because I think, as you mentioned, there are so many things that you are already paying for through benefits. And it's just bringing awareness that maybe this could be menopause. And then there's a saying, once you know something, you can't unknow something. So I think just opening that up to reducing the stigma, talking about menopause at work, talking about the benefits, talking about this is a phase of your life that's going to last more than a few years. And when you get the support that you need, then you can function at your best. You can reduce your brain fog. You can rearrange your schedule, maybe like delegate if you put into practice some of the things that you mentioned. So I think that's really important. Beyond the things that you mentioned, I'm just curious, if an organization wants to start looking into menopause and taking the steps that they want to take to reduce the stigma and talk about it more, what would you recommend? What's your experience with maybe like EAPs, or are you just going to incorporate this into, like you said, the benefits you already have? What would be your recommendation for an organization to start? What would be the steps?
I love that, because we are all about meeting employers at every stage of their journey. And we know that the most effective way to take action is to simply start with where you are. We're not here advocating for a whole revolution, for a whole overhaul in what you're doing. And most of the guidance that we're putting together and advocating through Health Action Alliance in partnership with AARP is actually very accessible. We're telling employers to start by simply looking at the benefits and policies and practices you already have in place, and start conversations. Start conversations with your workers, your managers, your leadership, your broker and payer partners. And we've been we're working with a set of tip sheets that make this very actionable, accessible, and break down what feels like it might be a very huge issue to take on into some ways that you can start building up from what you already have. So you mentioned our resources. We worked this year with AARP, our Women's Health Program Advisory Board, and actually a small cohort of experts and business leaders in a summer learning lab to develop 3 actionable tip sheets. One is on how you can empower conversations about menopause at work, offering tips for leaders to open up respectful, inclusive conversations around their workplace with ideas to engage managers, ERG leaders, and other stakeholders across the organization. We offer inclusive language tips, ideas for trainings, etc. We also have another tip sheet around naming and shaping your menopause strategy. And this has a very comprehensive set of checklists. You mentioned EAPs, that's on our checklist. Working with ERGs that you have in place, employee resource groups, to be spreading the word. Looking at other practices that you already have and how can you pull from this checklist those policies that already exist into the basis or a start for a communication strategy, or even if you feel ready for formalizing a menopause policy at your organization. We have sample language to help you get started with this. And also we encourage you to use this checklist to generate ideas for the next benefits that you want to add on from there. And then our last tip sheet is around improving healthcare benefits for menopause. We mentioned the need to kind of reduce that overhead and inefficient care. And we're really just advocating for you to have a conversation. So we offer a comprehensive set of questions and prompts that HR leaders can simply use to start a conversation with their brokers and payer partners to get a better understanding of their claims data, make smarter decisions about their coverage options, and improve streamlined access to the right care faster to reduce those overhead costs from misdiagnosis and ineffective treatment. We also took all of these tip sheets and turned them into a really interactive pulse check. So this should be a fun 15-question quiz that allows HR and benefits leaders to quickly benchmark their progress for their organization, along with tailored steps pulled from these tip sheets. All of this is available for free at healthaction.org/women's health, and we'll be sharing it in the comments.
I love that. I think that's so amazing because for the organizations listening, Sarah just gave you like the roadmap of how you start the conversation, the language you use, the pulse checklist, nice job. That's amazing. I think that's great. I think it's so important. And I think just talking about it more and realizing that if you are a woman at some point in your life, you will probably go through this, and there are resources out there and you don't have to struggle. And it's not about making huge changes. Like I do life change and personal training, and I've been doing health coaching for over 20 years. And it's always like, what's the next step? As you said, like start where you are, start where your organization is, download all these tools and checklists and things that Sarah has available to you, and just start small and start having that conversation. And supporting your employers is not only going to, it's going to help the bigger outcome. It's going to help the employee be more productive, to be more focused, to be happier and healthier at work. Like we are humans and we don't work in a box or in a bubble. Like the way that we feel in our life affects us at work, school, home, all of it. So I love what you're doing. I think that's so amazing. Are there any organizations that are stepping up and that are leading the way on menopause that are doing amazing? Let's hear about that.
I love this part of my job because we are all about gathering employees from every stage of their organizational maturity ladder and journey and hearing about what they're doing for the organizations that are higher on the maturity ladder. How can we use that to inspire others? And from the organizations that are maybe earlier in their journey, what is it that they need? What's really going to help them take that next step? And we've been inspired all along the way. As I mentioned, there's a lot of interest, there's a lot of excitement, there's a lot of love from people who are attending our events and workshops for starting these conversations. I also want to acknowledge that a lot of our work was developed with these employers and expert leaders, including our Women's Health Program Advisory Board. So recapping just a couple of stories that a few of those leaders have shared with us publicly. Dr. Tamara Duperval-Brown-Lee, who's the former Chief Health Officer at Accenture, has been a big advocate for uplifting employee voices in collaborative benefits design for mental health and women's health. And she shared about how she has worked with Accenture's menopause-specific employee resource group. I love the name, the Meno Warriors. And she actually co-designs and collaborates with them as intentional partners in thinking about where gaps and needs are and what possible solutions and workplace strategies can be to improve support in the workplace, but also in coverage design. We've also been joined by Dan Simons. He is the CEO and co-founder of Farmers Restaurant Group in the DC area. He's been a champion for male allies to join the conversation. And he actually hosted his own workshop this year just for men to join in conversations as allies on menopause. And he inspired a number of other men to join our cohort of business leaders in our summer learning lab on menopause this summer, where we fleshed out those tip sheets, including Jeffrey Walensky, who's actually going to be speaking with us at the Total Worker Health Symposium. And we're also excited to be joined at the symposium by Dr. Ranit Mishori. She's a physician and a public health leader from World Bank Group, an expert in women's health, and she also advised our work through our menopause learning labs this summer. Quick side plug, she's also going to be joining my colleague David Leathers to talk about the role employers can play to support worker health and resilience through climate change conditions at the symposium. So make sure you're checking out both conversations. We're really excited to be having her across our work.
I love that. That's so important. And I really appreciate that you mentioned the men, because I'm not quite sure what the actual stat is, but I know that during menopause and perimenopause is, if you make it through the first years of marriage, that's when the highest rates of divorce happen. And I think when men have an understanding of what's happening to the people they love, whether it's their partner or their sister or their mother, of things are different. And because of that, emotional regulation is different, and estrogen and serotonin and like the love hormones and how you speak to, like, all that is changing. And if you don't know what's going on, it might be perceived as something different. So I think educating all the humans of the world of what menopause is and how it affects us and how we can approach it a little bit differently so that we can have higher levels of success and health, I think that's all absolutely phenomenal. I really love the work that you're doing. I think it's so important.
I'd love to double click on that, because when men are joining these conversations about menopause in the workplace, so often what they're telling us is, I actually took this, and the first thing I did was I went and I talked to my wife about it, or my mom, or my sister. And they're using these tips at home first. And when we're talking about things that we can do in the workplace, opening up these conversations, starting employee resource groups, men want to be a part of those conversations. They want to join those groups. We're hearing from employers on our network that when they host workshops or webinars or hold these employee resource group sessions, men are often the most engaged in the conversation because they want to know how to support the loved ones in their life. They want to be better colleagues, and they recognize that this is something they don't know anything about, and they're really eager to learn. And it's been really encouraging and heartwarming to see just how receptive the men have been in these conversations. So we tell employers in our network, this is in our tip sheets, when you're holding these conversations, make sure you're including people of all ages and all genders. Because it's really important for men and women to be informed about what women go through the stage of life. And we need to be educating people earlier so that way when they do start experiencing these symptoms, they know and understand and can connect these symptoms to menopause and actually get the right care faster, because so many of us have been left under and uninformed.
Yeah, no, I love that. I think it's so important. We need to talk about it more. We need to educate on it more. I love it. Okay. Last question. It's a two-parter. Where can people join your session? I have it written down if you need me to read it for you. And then what do you hope attendees will get out of your session at the Total Worker Health Symposium?
So if we are going to be doing this virtual, I'm sure there will be the links broadcast online. This will be Thursday, October 23rd at 11 a.m. We're going to be doing a 45-minute workshop. And if it is in person, Sarah, you might actually, would you happen to have the room number in front of you? I realized I need to know where I'm going.
Yes, if it's in person, it's going to be in room C1/C2.
I just learned that myself. I'm going to be jotting that down after this.
Yes, we are hoping it's happening in person because both of us want to present at the National Institute of Health, but fingers crossed.
I have to give full credit to the organizers. They definitely sent out all this information. But yes, please join us there in the workshop in person if we get to be in person. Otherwise, we'll be seeing you online. And as for what I'm really excited for attendees to get out of the session, I'm personally very excited to get that opportunity to check back in with Jeff and Dr. Mashori, who will both be joining to talk about their own experiences joining our Menopause Learning Lab over the summer, and how they've been continuing to normalize menopause in their own organizations and the broader communities. I really think attendees are going to get a lot out of that conversation, hearing from real world leaders who are out there doing the work. And what I love about this is they actually come from very different places, both in their own gender experiences and identities. They come from different company sizes, and both represent organizations that are starting in different places in their own journey for menopause support. So I think you'll get to hear from that whole continuum of leadership and engagement, and it's going to be very inspiring to hear from these leaders in our cohort. We're also going to be dedicating time in this workshop session to help attendees review your own workplace policies using one of our tip sheets. So if you're planning to attend, come prepared. I'm really looking forward to hearing what each of you has to say in the session and some of the ideas that you come up with to inspire action at your own organization. It's always a learning experience as much for me as it is for people who come, and it continues to inspire us along our journey and how we support our network in making these changes.
Such important work. I think what you're doing is phenomenal. I think it's great that there's going to be a workshop component so that you can see where you're at, because as you mentioned before, we have to start with where we're at and then start making small changes, right? We don't jump to the top of a mountain. You climb a mountain one step at a time. So it was such a pleasure to learn all about what you're doing. Keep it up. And for those listening, my session is going to be also on the 23rd at 11:15. If we're doing it live, it's going to be in room F1, F2. Virtually, that link will be available when we know more. It's called Move at Work Challenge, Driving Employee Happiness and Health. But we look forward to seeing you, whether virtual or online. Tickets are still available on the website. And if you have any questions for Sarah or myself, you can leave it in the comments after this is live, and I will be linking all of the resources she talked about in the comments as well. Thank you so much for being here, Sarah.
Thank you so much for having me and for allowing us to spread the word about this important conversation today.
Yeah, it's going to be fun. Okay, hopefully see you in real life.
Yes, fingers crossed.